What if one medical decision after the age of 60 could quietly shape the direction of the next decade of life, determining whether those years are lived with strength, independence, and confidence, or gradually filled with weakness? Complications and a recovery process that never quite seems to end. It is a question that rarely crosses the mind in daily life, yet it carries enormous weight. As the body ages, it begins to respond differently to stress. Healing slows, and even routine medical interventions can have deeper and longer-lasting effects than expected. What once felt like a simple fix in earlier years can become a turning point later in life, not always in the way people hope. Independence, for many, is one of the most valuable aspects of growing older. The ability to move freely, take care of daily needs, make personal decisions, and stay connected to the world without constant assistance defines quality of life far more than any number on a medical report. Yet this independence is often more fragile than it appears. A single medical choice, especially one involving surgery, can either protect it or slowly begin to take it away. The shift is rarely dramatic at first. It can begin with a longer recovery than expected, a slight loss of strength, or a temporary decrease in confidence while walking or performing simple tasks. Over time, these small changes can compound, leading to a noticeable decline in physical ability and overall resilience. There is a common belief that if something in the body is not working properly, the most logical step is to fix it as quickly and directly as possible. Pain should be removed, damaged parts should be repaired or replaced, and modern medicine should provide a clear solution. This mindset has been reinforced over decades, as medical advancements have made it possible to treat conditions that were once considered untouchable. However, the reality is more nuanced. Especially in later years, the same intervention that offers a quick recovery for a younger individual may lead to a much slower and more complicated healing process for someone older. The body's ability to bounce back is not the same, and this difference changes everything. Modern research in aging and health has revealed that the effectiveness of certain medical procedures is not always as straightforward as people assume. While some treatments deliver life-changing benefits, others may provide only minimal improvement, particularly when weighed against the time, effort, and physical toll required to recover. This is not widely discussed in everyday conversations, yet it is a critical piece of understanding how to navigate health decisions after 60. The focus begins to shift from simply fixing a problem to asking a deeper question. Will this choice truly improve daily life in a meaningful way, or could it introduce new challenges that were not there before? Another important factor is how recovery itself impacts the body. Healing is not just about the surgical site or the treated condition. It involves the entire system. Periods of reduced activity can lead to muscle loss, decreased balance, and a drop in overall stamina. For someone who is already managing the natural effects of aging, even a short period of immobility can create a ripple effect that extends far beyond the original issue. Strength that took years to maintain can begin to fade in weeks, and rebuilding it is often much harder than expected. There is also an emotional and psychological dimension that is often overlooked. The experience of going through a medical procedure, followed by a challenging recovery, can affect confidence. Simple activities that once felt automatic may begin to feel uncertain. Walking without support, climbing stairs, or even standing for longer periods can become sources of hesitation. This shift in confidence can quietly influence behavior, leading to reduced activity, less social engagement, and a gradual narrowing of daily life. At the same time, not all medical decisions carry the same weight. Some interventions have the potential to restore function in a way that significantly enhances independence and quality of life. The key lies in understanding the difference between procedures that truly support long-term well-being and those that may seem helpful on the surface, but offer limited lasting benefit. This distinction is not always obvious, and it requires a more thoughtful approach than simply choosing the most immediate or aggressive option. The reality is that aging does not mean avoiding medical care, but it does mean approaching it with greater awareness. Every decision becomes more meaningful because its impact can extend further into the future. The goal is no longer just to address a problem, but to protect the ability to live fully and independently for as long as possible. This requires looking beyond short-term relief and considering how each choice will influence strength, mobility, and confidence over time. Understanding this perspective creates a powerful shift. Instead of reacting quickly to discomfort or diagnosis, there is space to pause, evaluate options, and consider what truly aligns with long-term well-being. It becomes less about doing more and more about doing what is right. In many cases, the most effective path forward is not the most immediate or dramatic one, but the one that supports the body's natural ability to maintain balance, strength, and function. The years after 60 can still be active, fulfilling, and independent, but they are shaped by the decisions made along the way. Knowledge becomes a form of protection, allowing each choice to be guided by understanding rather than assumption. And sometimes, the most important realization is that one thoughtful decision, made at the right time and for the right reasons, can quietly preserve the freedom to live life on one's own terms. Many people carry a deeply rooted belief that when something in the body begins to fail, the strongest and most reliable solution is to repair it as quickly as possible. Pain is seen as a problem that must be eliminated, and anything worn down is viewed as something that should be replaced. This way of thinking feels logical, especially in a world where medical technology has advanced so rapidly. Over the years, countless procedures have been developed that can restore vision, replace joints, and correct internal problems with remarkable precision. Because of this, it becomes easy to assume that surgery is always the most direct path to improvement, the final answer when other options seem too slow or uncertain. However, the reality of how the body responds to treatment after the age of 60 introduces a level of complexity that is often underestimated. Aging does not simply mean adding years, it changes how the body heals, adapts, and recovers. Tissues become more delicate, the immune response is not as quick, and the body's ability to rebuild strength after stress becomes more limited. What might have once been a short and manageable recovery can turn into a longer, more demanding process. This difference is subtle at first, but it has a powerful impact on outcomes. There is also a natural desire for certainty when dealing with discomfort or limitation. When pain interferes with daily life, whether it is in the back, knees, or any other part of the body, the idea of a clear and immediate solution can be incredibly appealing. Surgery often represents that promise. It feels decisive, proactive, and reassuring. The thought of fixing the issue once and for all can provide a sense of control in a situation that otherwise feels frustrating or unpredictable. Yet this sense of certainty can sometimes mask the deeper reality that not all problems have a simple mechanical fix, especially when they are connected to gradual age-related changes. Modern research in the field of aging has begun to highlight an important truth. Not every condition benefits equally from surgical intervention. Some issues are not caused by a single structural problem that can be corrected, but rather by a combination of factors that develop over time. Wear and tear, inflammation, muscle weakness, and reduced flexibility all play a role in how the body feels and functions. Addressing just one part of that equation does not always resolve the entire issue. In fact, focusing too narrowly on a single solution can sometimes overlook other approaches that may offer more balanced and sustainable results. Another important consideration is how the body handles the stress of a procedure itself. Surgery is not only about the moment it takes place, but about everything that follows. Recovery requires energy, resilience, and the ability to rebuild. For an older adult, this process can place a significant demand on the body. Even when a procedure is technically successful, the period of healing may involve reduced movement, changes in routine, and a temporary loss of strength. These effects can extend beyond the original problem, influencing overall mobility and independence in ways that are not always anticipated. There is also a tendency to view minimally invasive procedures as risk-free or universally beneficial. While these techniques are indeed less disruptive than traditional surgery, they still involve intervention, healing, and adjustment. The word minimally can create a sense of comfort that may not fully reflect the experience of recovery, particularly for someone whose body no longer adapts as quickly as it once did. Every procedure, no matter how small it appears, carries some level of impact, and that impact becomes more significant with age. At the same time, it is important to recognize that not all surgeries are unnecessary or avoidable. Many procedures provide extraordinary benefits and can dramatically improve quality of life. The challenge lies in distinguishing between those that truly address a meaningful problem and those that may offer only limited improvement. This distinction is not always obvious, and it often requires a deeper level of understanding and careful consideration. The conversation around medical decisions after 60 begins to shift from a simple question of, can this be fixed, to a more thoughtful one, will this truly improve how life is lived every day? This includes considering not only the potential benefits of a procedure, but also the time required to recover, the possible changes in strength and mobility, and the overall effect on independence. It becomes a matter of weighing immediate relief against long-term well-being. In many cases, non-surgical approaches can play a powerful role in managing and even improving certain conditions. Strengthening the body, improving balance, reducing inflammation, and supporting natural movement patterns can lead to meaningful progress without the added stress of a procedure. These approaches may require patience and consistency, but they often work in harmony with the body rather than placing it under strain. For some individuals, this path leads to outcomes that are not only effective, but also more sustainable over time. The key is not to reject medical intervention, but to approach it with awareness. Understanding that surgery is one option among many allows for more balanced decision-making. It creates space to explore alternatives, ask questions, and consider what truly aligns with personal goals and priorities. For someone who values independence, mobility, and the ability to remain active, these factors become just as important as the technical success of any procedure. Ultimately, the most powerful decisions are those made with clarity rather than urgency, taking the time to understand the nature of a condition, the range of available treatments, and the likely outcomes can transform the entire experience. Instead of feeling pressured to act quickly, there is an opportunity to choose wisely, with a focus on preserving strength, confidence, and the ability to live fully. The belief that surgery is always the strongest solution begins to evolve into something more refined. It becomes an understanding that the strongest choice is not always the most immediate, or the M. Aggressive, but the one that supports long-term health and independence. And in that understanding lies the ability to navigate the later years of life with greater confidence, balance, and control. According to data gathered from leading medical centers, a surprising pattern has quietly emerged over the years. Thousands of older adults undergo medical procedures every single year with the expectation that their lives will significantly improve, only to discover that the long-term results are not as meaningful as they had hoped. At the same time, there are other procedures, often less discussed or sometimes delayed, that have the potential to dramatically preserve independence, mobility, and overall quality of life. Yet they are postponed until the body is already under greater strain. This contrast reveals something important. The challenge is not simply access to medical care, but understanding which decisions truly matter. As people move beyond the age of 60, health decisions begin to carry a different kind of weight. It is no longer just about solving a problem in the moment, but about shaping how life will be lived in the years ahead. Every choice has a ripple effect. A procedure that requires long recovery may temporarily limit movement, which can lead to muscle weakness. That weakness can affect balance, and balance plays a direct role in confidence and independence. What begins as a single decision can quietly influence many aspects of daily living. One of the reasons this issue often goes unnoticed is because the focus is usually placed on the immediate outcome. When a procedure is recommended, the conversation tends to center around what it aims to fix. There is less emphasis on what happens afterward, particularly in the context of an aging body. Recovery is often described in general terms, but the reality can vary significantly depending on age, patient, physical condition, and overall resilience. For older adults, even a routine recovery period can bring unexpected challenges. There is also a natural tendency to trust that more intervention leads to better results. The idea that doing something is always better than doing nothing feels reassuring. It creates a sense of action and progress. However, in the context of aging, more is not always better. In some cases, less invasive approaches or even careful observation combined with supportive care can lead to similar or better outcomes without placing unnecessary strain on the body. This does not mean avoiding treatment, but rather choosing it wisely. At the same time, there are procedures that hold tremendous value when performed at the right moment. These are the interventions that directly support the functions most closely tied to independence: clear vision, stable movement, and reliable heart function. When these areas are protected or restored, the benefits extend far beyond physical health. They influence confidence, safety, and the ability to remain engaged in everyday life. Delaying such procedures can sometimes lead to avoidable complications, making recovery more difficult than it needs to be. This creates a delicate balance. On one side, there are procedures that may be overused, offering limited long-term benefit for the effort they require. On the other side, there are procedures that may be underused or delayed, even though they have the potential to make a meaningful difference. Navigating between these two requires a shift in perspective. It involves looking beyond the surface and asking deeper questions about purpose, timing, and expected outcomes. Another important aspect to consider is how expectations influence decisions. When a procedure is presented as a solution, it is natural to expect a clear improvement. But not all conditions respond in a predictable way. Some are influenced by multiple factors that cannot be fully addressed through a single intervention. When expectations are too high, even a technically successful procedure can feel disappointing if it does not lead to the desired change in daily life. Understanding this in advance can help create a more realistic and balanced view. The role of information becomes critical in this process. Having access to clear, honest insights about the benefits and limitations of different options allows for better decision-making. It creates an opportunity to move away from assumptions and toward understanding. This is especially important in later years when the goal is not just to treat a condition, but to maintain a certain way of living. Independence, mobility, and mental clarity become priorities that shape how each option is evaluated. There is also value in considering the timing of decisions. Acting too quickly without fully exploring alternatives can lead to unnecessary interventions. Waiting too long, on the other hand, can allow a manageable condition to progress to a point where treatment becomes more complex. Finding the right moment requires awareness, patience, and often a willingness to have open and thoughtful discussions about risks and benefits. In many ways, this stage of life calls for a more intentional approach to health. It is less about reacting to problems as they appear and more about understanding how each choice fits into a larger picture. The question shifts from what can be done to what should be done to support the life that is desired moving forward. This perspective brings clarity and helps align decisions with long-term goals. The truth is that not all procedures are created equal in terms of their impact on everyday life. Some may address a symptom without improving overall function, while others can restore abilities that make a profound difference. Recognizing this difference is one of the most important steps in making informed choices. It allows each decision to be guided by purpose rather than pressure. By understanding these patterns and approaching each option with greater awareness, it becomes possible to avoid unnecessary risks while embracing opportunities that truly enhance well-being. The path forward is not about avoiding care, but about choosing it with intention. And in doing so, it becomes possible to protect not just health, but the freedom to live each day with strength, confidence, and independence. It often begins as something small, almost easy to ignore at first. A dull ache in the lower back that comes and goes, sometimes fading with rest and then returning without warning. At first, it may feel like nothing more than a normal part of aging, the kind of discomfort that can be managed with a bit of stretching or a slower pace throughout the day. But over time, that ache can become more persistent. Sitting for longer periods starts to feel uncomfortable. Standing requires more effort. And simple movements like bending or turning may trigger stiffness or pain that lingers longer than expected. As the discomfort grows, so does the frustration. There is a natural desire to find a clear and lasting solution, something that can bring relief and restore a sense of normalcy. For many, this is the point where the idea of a more permanent fix begins to take shape. When conservative treatments such as rest, light exercise, or basic pain management no longer seem to provide enough relief, the ought of a surgical option can feel like the next logical step. It represents the possibility of finally putting an end to the discomfort rather than continuing to manage it day by day. One procedure that often enters the conversation at this stage is spinal fusion. It is presented as a way to stabilize the spine by permanently connecting two or more vertebrae, reducing movement in the area that is believed to be causing pain. On the surface, the concept appears straightforward. If movement in a certain part of the spine is creating discomfort, then limiting that movement should reduce the pain. This line of thinking feels intuitive, and for specific conditions, particularly those involving clear structural instability or nerve compression, it can indeed be beneficial. However, when it comes to chronic lower back pain without significant nerve involvement, the situation becomes far more complex. The spine is not a simple structure with a single point of failure. It is a dynamic system supported by muscles, ligaments, and joints that all work together to allow movement while maintaining stability. Pain in this area is often the result of multiple contributing factors rather than one isolated issue. Weak muscles, reduced flexibility, poor posture, and gradual wear over time can all play a role in how the back feels and functions. When a portion of the spine is fused, it does reduce movement in that specific area, but it also changes how the rest of the spine operates. The segments above and below the fused section are forced to take on additional stress to compensate for the loss of mobility. Over time, this increased strain can lead to further wear in those areas, sometimes creating new sources of discomfort. What initially seemed like a targeted solution can gradually shift the burden elsewhere, leading to a cycle that is not always easy to predict. Recovery from such a procedure is another important consideration, especially for older adults. Healing requires not only time, but also physical resilience. The body needs to rebuild strength, restore balance, and adapt to the changes created by the surgery. During this period, activity levels are often reduced, which can lead to muscle loss. For someone already experiencing the natural effects of aging, even a temporary decrease in movement can have noticeable consequences. Muscles that support the spine may weaken further, and regaining that strength can take considerable effort. There is also the factor of balance and coordination. The spine plays a central role in how the body maintains stability. Any change to its structure can influence posture and movement patterns. During recovery, there may be a period where balance feels less secure, increasing the risk of falls. For older individuals, this risk carries significant weight, as even a minor fall can lead to complications that extend far beyond the original issue. What makes this situation particularly challenging is that the results of spinal fusion for non-specific chronic back pain are not always as consistent as people expect. Some individuals do experience relief, but others find that the improvement is limited or temporary. Studies have shown that in many cases, outcomes are comparable to those achieved through non-surgical approaches, such as targeted physical therapy, strength training, and posture correction. These methods focus on addressing the underlying support system of the spine, rather than restricting its movement. Non-surgical approaches often require patience and consistency, which can make them feel less appealing at first. Progress may be gradual, and it may not provide the immediate sense of resolution that surgery seems to promise. However, these approaches work with the body rather than altering its structure. By strengthening the muscles that support the spine, improving flexibility, and correcting movement patterns, it is possible to reduce strain and improve function in a way that is sustainable over time. There is also an important psychological aspect to consider. Choosing surgery can sometimes create an expectation of a complete and permanent fix. When the results do not fully meet those expectations, it can lead to disappointment or a sense of uncertainty about what to do next. On the other hand, non-surgical approaches encourage a more active role in the healing process. They involve learning how the body works, building strength gradually, and developing habits that support long-term health. This can lead to a greater sense of control and confidence. None of this suggests that spinal fusion is never appropriate. There are specific situations where it plays a critical role and provides meaningful benefits. The key is understanding when it is truly necessary and when other options may be equally or more effective. For chronic back pain without clear structural instability or nerve compression, it becomes essential to look carefully at all available approaches before making a decision. In the end, the goal is not simply to eliminate pain, but to improve how the body functions in everyday life. Movement, strength, and stability all contribute to independence and overall well-being. Choosing an approach that supports these elements, rather than limiting them, can make a significant difference in how life is experienced over time.